Hey everyone, welcome back to our second Facebook Live ever. We're happy to have you again this afternoon. My name is Laseter Clark and I do the marketing here. And today we've got a different doctor with us. We have Dr. Jeff Laseter, and he is one of our spinal interventionists. He's going to talk about when you need to get injections, the type of injections, their effectiveness, side effects. So make sure you comment and you ask us questions because he's here and he can answer them for you. We're also going to be giving away some gift cards to people who ask questions. So if you win, I will message you and be sure to put that in the mail to you. So we've got Dr. Laseter here, and let's get started.
Hello, I'm Dr. Jeff Laseter. First, I would like to say to everybody stay safe, follow the governor's guidelines and your local official guidelines during this pandemic. We want everybody to stay safe here. First, Laseter just wanted me to introduce myself and to tell you a little bit about myself. I'm from Mississippi. I grew up in a small town in South Mississippi, Ellisville, Mississippi. I went to South Jones High School there, went to Jones Junior College for a year, and then went to the University of Mississippi at Ole Miss. Graduated from Ole Miss. Then I went to medical school at UMC. After I graduated from medical school, I started out in general surgery, which I did an internship at Baptist Hospitals in Birmingham. After that, I switched to anesthesia and went to the University of Texas Galveston branch, UTMB, which I did anesthesia for 2 years. I then transferred to the Cleveland Clinic, where I finished my anesthesia training and then did a pain fellowship at the Cleveland Clinic Foundation. Upon graduating from my fellowship, I started Mississippi Pain Center in Pascagoula, Mississippi, and I practiced there for 5 years. Then I moved to Jackson. I joined Dr. Jeff Summers at Mississippi Pain Management and was there for a number of years, and then joined New South Neurospine, which I'm in the Spinal Intervention Division with Dr. Jeff Summers. So we would like for you to ask questions. If you have questions, we'll be glad to answer them. I'm here to talk about what I do, mainly the spinal intervention, which is basically injections. And does anybody have any questions they want to start out with?
Why don't you start talking about just the different types of injections you do?
Okay.
And how they help.
We're called the Spinal Intervention Division, and we're do very minimally invasive procedures, basically injections. And we can target specific areas in the spine for the injections, whether it be an epidural injection, a nerve root injection, a facet joint injection. So we can target different areas of the spine. We also can do ablasive treatment where we actually kill or ablate the small nerves in the spine. So there are a number of things that we can do with injections, and that gives an opportunity for the patients to get pain relief and so they can function better. We try to be very conservative here. Not everybody needs surgery. The majority of people can be treated conservatively with injections, physical therapy, and we can get the majority of people better without having to have surgery. Now, if surgery is indicated, we have a fine group of surgeons here that can do that. So we have everything here available at New South Neurospine, which we have the surgical division with the neurosurgeons and orthopedic spine surgeon, as well as physical medicine, which can direct your physical rehab and your conservative treatment.
What are some of the side effects of an injection?
Well, when we do an injection, we'll just go through the procedure. Usually what we do, we bring you back to the procedure area. You're pre-oped by one of the nurses. She goes over all your history and everything that we've already done before. You have some paperwork to go over. They start an IV. Then they bring you back to the procedure room where you're usually placed with your face down, because if we're injecting the back, you'll be placed face down. They prep and clean off your back, and we drape it out in a sterile fashion. If you want us to, we can give you a little sedation for the procedure. We don't put you all the way to sleep for the procedures, but we can give you like a small twilight to relax you, okay? Next we numb up the skin, which we use lidocaine, which is a stick and sting, burns a little bit. That numbs up the skin. Then we go in with a very small needle. The needle is very small. It's about as thin as hair. It's really, really small. We're able to do under x-ray guidance. So we don't need a big needle. We know exactly where we're going. We go to the target area. We use multiple views on x-ray to make sure we're in the right position. Then we'll inject a small amount of contrast material to make sure we're in the right spot and make sure the medication's going right where we want it to go. Then usually we'll inject a local anesthetic, which is lidocaine, and also we use a steroid, and the majority of the time we use Decadron, which is a very safe steroid that's been used for a long period of time. Afterwards, you go to the recovery room. We'll watch you there for a little bit, and we'll let you go. Okay? You cannot drive home. You have to have a driver after the procedure. With the steroid injection, you can see some side effects with the steroids. Okay? The most common thing we see is a flush, where the people may feel hot, flushed. Also, it may make you feel a little hyper. So, a lot of times the first couple of nights you may not sleep well. Okay, you'd be very hyper. We've had stories of people getting up in the middle of the night, cleaning their kitchen, mopping their floors. So what we suggest is, if you're able to, usually Benadryl will help quite a bit to help you sleep and also help decrease the flush. We very rarely see any weight gain with this. The amount of steroids we inject is a very small amount. Okay, so actually what we do, we put the steroids right where they need to go, in a very specific area. So you use only a small amount of steroids, okay? Instead of taking steroids by mouth, you're taking a large amount of steroids, and you have a lot of side effects. By injecting a small amount of steroids and put it in the right place, it works better, and you have less side effects. So that's the whole purpose of the injection, is to put the steroids right where they need to go. And the purpose of the steroids is to decrease the inflammation. Let's say you have a disc herniation and the nerve root's irritated. So the disc is in between the vertebra here. It can protrude out and compress, or it could irritate the nerve root. All right. When the nerve root's irritated, it becomes very swollen. That's when you get pain radiating down your leg. So we can target an injection where we inject right around the nerve root, where we inject the steroids to get the inflammation down around the nerve to help with your pain. Also, we want to get the steroid medication around the disc area to give that disc a chance to heal. Okay? Once you get the inflammation down, that disc can heal over time. The steroids do not directly affect the disc, but if you can get the inflammation down, then the disc can heal over time. So basically what we're trying to do is get the inflammation down so your body can heal. We have any questions out there?
Yes, we do have a question. Summer asks, what symptoms are best treated with injections?
Well, we can do different types of injections for different problems. The most common would be an epidural injection in the lumbar spine or the low back, and that's when you have the disc that's protruding out like I described, irritating the nerve, and that would cause pain to go down your leg. Now also, we can do injections for people who have back pain, and a lot of times they have what we call facet problems, where the little joints in the back here, they're hinge joints, and they give you movement back, mainly into the side. And so during examination, if you have just purely back pain, sometimes we think it may come from the facet joints. And so what we can do, we can go in and inject the facet joints, put some numbing medicine, some steroid medicine into the joints. And what we're trying to do is get the inflammation down and get your pain better. We usually do that in combination with physical therapy to get your range of motion back and to stretch and strengthen the muscles. Now, if you have short-term relief, there's a procedure where we can go and we can block the little nerve that goes into the joint, okay? And that will help confirm if that's where the pain's coming from, okay? That's only short-lived. Then we can go in with a very special needle, which we do what we call a radiofrequency ablation, where we can go in and ablate or kill the nerve, actually, okay? That's percutaneously done. There's no incision. And we go in and we heat up the tip of the needle, and it kills the nerve that goes into the joint, okay? The good thing about that is it gets rid of the pain. The bad thing about it is the nerve does grow back in about a year, and there's a good chance your pain may come back. So that's reserved for people who have severe pain that have failed conservative treatment. But we can also do the same thing in the neck, where we can target the joints or the nerves. So it depends on what your problem is. We can help pinpoint what's causing your problem. And a lot of times we'll do diagnostic injections, which are requested by the surgeons to determine where your pain is coming from and to help determine what area needs surgery. So there are a lot of different areas that we can target with the spine for the injections.
So when you put an injection in there to the joint,
right,
it loosens it, and then most people, after they have that injection, do you then send them down to physical therapy so that they can move and heal that area more?
Usually what we do when we have people have facet problems, that means you have back pain, axial back pain. You don't have pain going down your leg, okay? And that can be caused from the facet joints. The joints, like I said, are the little hinge joints in the back. You can go and inject the joints, all right? And what you're trying to do is get the inflammation down into the joints. And usually what we do, we work with the physical medicine doctors, Dr. Vore, Dr. Collett, Dr. Winkleman, and they can get you set up in a very personalized physical therapy program specific for your problem. So after we do the injection, we get you started in a very personalized physical therapy rehab program for your problems. So other people also have muscle problems that are involved. They have to be addressed. Some people have hamstring problems. So our physical medicine doctors can come up with a very special, tailor-made program just for you. And that's why it's important that we rely on them, that they can give that personalized service to the patients. So after we do the injections, get you started in a physical therapy rehab program that's personalized for you. What the therapy will do will help stretch, strengthen the muscles, and get that joint moving again, okay? And once we get that joint moving again, it's just like when your knee in the morning, when you're very stiff and you get up, and after you move it, it starts lubricating. And so what we want to do is get that joint moving again with you flexing and bending, okay, especially doing flexion things first, because when you start to extend, it can make your pain worse. And so then we gradually will add some extension things as you get better. But the important thing is to be diligent with your physical therapy and your rehab. The injections are not something that are meant to be just standalone. We like to do it in conjunction with the physical rehab program, and we think that's very important. And luckily here at New South Neurospine, we have a very dedicated physical therapy department, which are specially trained in spine. No other place has as many physical therapists that we have that are specially trained in spine. So if you're able to come here, I realize that people live in different areas and it may not be feasible, but if it is feasible, we have a very good physical therapy department that give a lot of hands-on. It's not a lot of shake and bake, not a lot of somebody just watching you do exercises. There's a lot of hands-on manipulation, mobilization, and special exercises just for you.
Another question from Renee.
Okay.
How many epidural injections are needed?
Everybody's different. What we go by is how you respond to the injection. You always hear people talk about a series of 3. Well, that really doesn't make sense to me, okay? Some people don't need 3, okay? A lot of people will get better with just 1 injection, okay? So what we do the injection, we see you back, we evaluate you, we examine you, and then we'll make the determination if you need another injection. Let's say we do an epidural injection, you come back and you're 50% better. You're a lot better, but you're still hurting. You're still having to take medication. At that point, we will repeat the injection. Okay, and with each injection, what you want to see is progressive improvement. Okay, and sometimes it may take up to 3. The limiting factor on the injection is usually with Medicare and the insurance companies, they'll usually will allow 3 per year if you need it. But a lot of people do very well with 1 injection, some people with 2, and sometimes they'll have to have 3. But you're not set to have a set number of injections, okay, because we want to get you better. And some people it may take 1 injection, some people may take 2, and occasionally some people it may take 3. But the important thing is you're getting progressive improvement with injections. Now, if we do an injection and it doesn't help, it doesn't make sense to repeat it. You hear people say, well, it didn't take, I have to get another injection. The injection was performed correctly, okay? And you're either going to get better or not. If you don't get better, then may not necessarily be the problem, okay? We may need to do another injection, or we may inject a different nerve. Sometimes you may have more than one nerve involved, and sometimes it can be difficult to tell which nerve is involved or not, because your MRI scan may show there's a problem at multiple levels. So if you do an injection and you don't get a response, it really doesn't make sense to repeat something that's really not helping. But we can reevaluate you and determine if there's something else that's causing the problem.
Is it normally, Julie wants to know, how long does it take to see a response or relief, and is it immediate?
With the injection, the first thing we inject contrast. And usually when we inject a contrast, it's a very thick substance. It can be irritating, okay, because the nerve is inflamed, okay. Right after that, we usually inject a local anesthetic, okay, which numbs the nerve, okay. That will last for a number of hours. So usually after injection, you'll feel better after the injection. Now, after the injection, the numbing medicine or local anesthetic will wear off, okay. So for the next day or two, up to a couple of days, you may not feel quite as well, okay. It usually takes the steroids a few days to kick in till you start feeling the effect of the steroids, okay? So it usually takes 2 or 3 days. Now, occasionally it may even take up to a week. It depends on how bad the inflammation is. So everybody's different. So usually, rule of thumb is usually a few days, and occasionally it may take up to a week to see a response. And then what we want to see is how long you have a response to the injection. So that's when we usually see you back in within a couple of weeks. The duration of steroids lasts up to about 2 weeks maybe, and so we'll see what kind of results you have with the injection and then determine the next course of treatment.
Anne wants to know, would injections be an option for someone with intermittent but severe back pain?
Yes, it may be. Yeah, that's important to have an evaluation. And unfortunately, during this time, we're not able to do a lot of things, but we do have telemedicine. And which we can do telemedicine here. All our departments have it. It's pretty easy to do. You can even go to a website to request it, or you can call our number and we can set you up for a telemedicine conference. We send you a link or either email to your phone or your computer. You just click on it, put your name in, and that's all you have to do. So it's very simple to do, and that's something that we offer now, is telemedicine. Hopefully after this pandemic, we'll be able to see patients regularly like we have been. And it's very important for your problem to have an evaluation, okay? When we evaluate you, we go over your history, we go over what's causing your problem, what happened, we go over your imaging, we do a physical examination, then we'll go over your diagnosis, and we'll go over possible treatment options for you. But it's very important to have an evaluation and to have a physical examination. We do that on everybody that comes in. There are a lot of people that just do injections, so they never examine the patients. I think it's very important to listen to your patients. They can tell you what's going on, what the problem is, and also it's very important to do a physical examination. Actually put your hands on the patients to help see where the problem is. That can help tell you exactly what may be causing the problem. So I cannot stress enough how important it is to have an evaluation.
Frank wants to know, if the patient isn't responding to the injections, what is the pathway for additional treatment for their pain?
Okay. It depends on what the problem is. A lot of times, if you don't, let's say we talked about the disc herniation here, and you have a disc herniation, we've done injections. Let's say you got some relief with the first injection. We repeated it, didn't get any better. You're getting worse. Well, we do examination. Now, you may be getting a little weakness that you didn't have before. At that point, we would recommend that you get evaluated by one of our surgeons because they have treatment options for you. There's no reason to keep doing injections if you're not getting any better. So if there's a problem that needs to be addressed surgically, our surgeons are very skilled. They have minimally invasive techniques where they can do small incisions, they dissect out, they use a microscope, very, very precise surgery. And a lot of these can be even done on an outpatient basis. So if we're not getting you better with injections, you might need to have the problem fixed. Now, if there's not a problem that can be fixed, then we're lucky to have our physical medicine doctors that do the conservative treatment, where it be medication management, bracing, TENS units, different other conservative treatment. So just because you don't respond to the injection doesn't mean we don't have other treatment options for you. That's why we have everybody here under one roof that we can take care of your complete problem. Are we going to give anything away?
Yeah, we are going to give away some gift cards. I want some people to ask a couple more questions.
Okay.
Just go a little bit longer.
And we have our hand sanitizer.
We do.
Which we use, our NS2 hand sanitizer, which we're staying clean. Got my mask I wear, so we're being very protective here.
Why do you have two masks on? Tell everybody about those two.
Well, actually I have an N95 mask, okay? And then I have a mask on top of that, and the reason I do this because I don't want to contaminate my N95 mask, okay? And then I have my protective eyewear. And we're being very cautious here at NS2. If you come here, you'll be met at the door. You'll have a questionnaire that you'll have to fill out. They'll take your temperature. If you have a temperature, you will not be let into the building. If you need to wait in your car, you can wait in your car till you're being seen. So we're taking all precautions that we possibly can to make things safe for you.
We do? Okay, we have another question.
Okay.
Michelle wants to know, does an injection help give relief from pain incurred as a result of the bulging disc? For example, would muscle pain from like not moving your neck
Right.
in a certain way?
Well, what happens a lot of times when you have the disc problem, the nerve becomes inflamed. That's why you have the pain going down your leg, okay? Because the nerve is inflamed, the things around the nerve become inflamed also. Okay, the muscles become inflamed. They can become tight, sore, tender. Okay, also you may be limping. Okay, because it's painful. That also throws off your gait, and that can cause some muscular problems too. So what we're trying to do with the injection is get the inflammation down the main problem. Now, if the main problem is the nerve irritation, you can treat the muscles all you want, and you'll get short-term relief. But until you treat the underlying problem, you're not going to get better. So it's important first to treat the underlying problem first, then you can treat the muscular component. And that's why we rely a lot on our physical medicine doctors that can set you up in a very detailed, tailored program to address your muscular problems. What needs to be done, what muscles need to be stretched, what needs to be strengthened. So we can come up with a very tailored program just for you because everybody's different. Some people may have more muscular involvement than other people. Some people may be just purely a disc problem with pain going down their leg with no muscular involvement. So everybody's different. So it's important to get an evaluation to make sure exactly what's causing the problem.
Ann wants to know, do you have to have a referral for new patients?
Yes, you do have to have a referral. Most insurance companies require it, and so does Medicare. We take referrals from all physicians, usually your primary care physicians, where we get a lot of referrals to. But no, we usually have to have a referral because it's usually required by insurance and Medicare.
Nikki wants to know, what's the recovery time after an injection and how long would a patient need to be off of work?
Okay. The recovery time is very short. It's not a painful injection. It's not a real painful procedure. Like I say, after a procedure, you go to recovery room. We want you there for about at least 30 minutes to see how you're doing, make sure you're doing okay, monitor your vital signs throughout. Then we'll let you go with your driver. That day, we tell you to take it easy, okay? Don't do anything strenuous. You don't have to stay in bed, but normal activities. When you leave, you can eat what you feel like. If you're a little nauseated or feel a little queasy, I would recommend eating something light. But if you feel better, you can have a normal meal. But during that day, take it easy. Don't do anything strenuous. Usually what we recommend is for you to take the day after the injection off, okay, if possible. I understand some people have to work. The reason being, we want to give that steroids a chance to work, okay? Because usually within a day or two, you'll start seeing some effects of the steroids. So we really, if possible, we would like for you to, take the next day after the injection off to give it some time to work, okay? Now, for the next couple of weeks, remember your body's trying to heal. So we want you to be careful what you're doing, okay? We don't want you lifting, twisting, bending, doing things that aggravate the pain. A good rule of thumb is, if it's painful, don't do it. That's your body telling you it's starting to become inflamed again. So we want you to be real careful after the injection, because we don't want you to do something that's going to make the inflammation worse. I can tell you, we see patients all the time. We do the injection. They say they feel the best they've ever felt. They go outside, they cut wood, work in the yard, mow grass. We have one guy roof his house, do all kind of things, and they come back crawling back in, saying, "Doc, I'm dying. You got to do something." Well, they overdid it. So it's very important not to overdo it after the injections, okay? All right. Any more questions?
We do have one. Mallory wants to know, how many injections does it take to get relief, and what happens if they aren't successful? Like, what's the next step?
Right, and we talked about that a little bit. It's important after an injection that we see reevaluate you. Just because the injection doesn't help doesn't mean there may not be something else we could do. But like I say, you need to get, for us to continue to do injections, you want to get progressive improvement with the injections. Now, if the injections don't help, then we'll go over options with you. And like I say, we have other options, whether it be surgery or whether it be conservative treatment. So just because the injections don't help doesn't mean we don't have other options available to you. So it's important that you come back and see us even if the injection didn't work, so we can reevaluate and see what's going on. Sometimes we even may have to do more imaging, okay? Sometimes the MRI doesn't tell us a whole lot. We may have to get a myelogram, post-myelogram CT scan to help tell us exactly where the problem is. Or sometimes if you're getting weakness, we may have to have one of our physical medicine doctors do an EMG or nerve conduction studies to see if you have weakness or ongoing nerve loss. And if that's the case, then surgery would probably be indicated at that point. So we have a number of options for you. And just because you had an injection that didn't work, it's important that you follow up and see us so we can reevaluate you.
Before we sign off, talk about why New South Neurospine is the best place to go for your spine care needs.
Well, I'm kind of biased because you have everything under one roof, okay? You have different disciplines, whether you have neurosurgery, orthopedic spine, spinal intervention, physical medicine. We all work toward one thing, trying to get you better. And we have different things to offer different people. So it's not just one treatment for everybody. We have a team that's dedicated to the treatment of spine, and we offer everything here under one roof. Also, we have, once a week, we have a conference, spinal conference, where all the doctors get together. We discuss difficult cases, and that gives us a chance to interact with each other and to help bring the best care to the patients. If there's a difficult problem, usually between all of us, we can find out a solution for you. So it's important that you have so many doctors with different disciplines under one roof. So that way you get complete care, that it's just not one size fits all. So we have different specialties here that all work together. And I think that's the best thing for the patients, because we can provide every service that you need for your spine care in one place.
One last question. How common is it when you ruptured your L4, L5, that the other disc on the opposite side rupture as well?
So they had a double herniation on both sides?
Well, I think maybe it's on one side, and she wants to know what's the probability of it doing it on the other side.
Okay. You could you can re-injure the disc. You know, sometimes what we see is if you have a disc herniation on one side, okay, but your pain is on the opposite side. And you tell the people that, and they say, what's wrong? You must have read the scan wrong. No. What happens sometimes, because the disc is protruded out, it has inflammatory factors, and those factors can affect the nerve on the opposite side. The good thing about people in that situation is they don't need surgery for that, okay? Because the problem is inflammation, and they usually respond really well to injections.
Okay. All right, so we have some gift card winners. We have 2 today.
All right, we have 2 today. One is Michelle Allen, and the other one is
I think it's also
Michelle Ogden.
Ogburn. Michelle Ogburn and Michelle Allen.
Okay, so we got 2 gift cards to give away today.
Yep.
We thank you very much for tuning in with us today. Like I say, if you need an appointment, we're able to do telemedicine here. It's easy, simple to do. The main thing, stay safe out there, everybody. Follow the guidelines. Be safe right now. I know it's crazy times. Believe me, everybody's getting tired of being quarantined, but stay safe out there.